Welcome back to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will be discussing numerous important key developments these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to June 12, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform HealthConnect Middle East. The past week saw Middle Eastern countries advancing ambitious health initiatives. Governments across the Gulf continued rolling out summer occupational safety policies and broad health campaigns to safeguard workers and citizens. At the same time, the region showcased cutting-edge innovations, from AI-powered healthcare solutions to new medical research breakthroughs, underscoring a growing commitment to life sciences and digital health. Several nations expanded healthcare infrastructure and funding, aiming for greater self-sufficiency in pharmaceuticals and wider coverage under universal health schemes. Meanwhile, ongoing conflicts and humanitarian crises in places like Gaza, Yemen, and Syria continued to strain public health systems, with international organizations stepping in to bolster resilience. This report details key developments in healthcare policy, scientific research, biotech, public health threats, wellness promotion, digital health, hospital infrastructure, and population health management across the Middle East during the week of June 12 to 18, 2025, highlighting both region-wide trends and country-specific progress. Together, these narratives paint a portrait of a region striving to improve health and wellness amid diverse opportunities and challenges. Let's first discuss healthcare policy and government initiatives. GCC summer work bans and occupational health. Gulf countries reinforce seasonal labor protections to prevent heat-related illnesses. The UAE's Ministry of Human Resources announced its 21st annual midday break policy barring outdoor work from 12:30 to 3 p.m. between June 15 and September 15. Compliance has exceeded 99% in recent years, reflecting widespread support for safeguarding workers in extreme summer temperatures. Saudi Arabia similarly imposed a 3-month ban on midday outdoor work from June 15 to September 15, instructing private firms to adjust hours and provide shaded rest areas. Bahrain's Labor Ministry launched a Safe and Healthy Summer awareness program to educate workers on heat stress prevention, complementing its extended noon work ban. Qatar and Oman also enforced nationwide summer work hour restrictions starting in June, part of a region-wide commitment to occupational health and safety. Kuwait's health screening for expatriates. Kuwaiti authorities rolled out stricter medical screening requirements for incoming expatriate workers to curb infectious disease risks. Under new regulations effective this month, visa applicants must undergo comprehensive health examinations in their home countries, approved via Kuwaiti consulates, and pass a second medical on arrival to obtain residency. Tests cover HIV, hepatitis B and C, tuberculosis, and region-specific diseases like malaria, especially for high-risk jobs in food handling, healthcare, and personal care. The Health Ministry will update the list of countries requiring screenings based on global disease trends. By enforcing these measures, Kuwait aims to protect public health while ensuring foreign workers entering sectors like restaurants and clinics meet strict health standards. Universal coverage efforts. Jordan and Egypt. Jordan is progressing with health financing reforms to expand insurance coverage. Officials note that the first phase of a comprehensive health coverage plan approved last year is underway, focusing on strengthening primary care and consolidating clinics for efficiency. Over the past year, Jordan opened 12 new health centers in 8 governorates and expanded multiple hospitals, including Prince Hussein bin Abdullah II Hospital, to improve service access. In Egypt, robust government support is reflected in a 24.9% increase to the health budget for FY 2024-25, raising it to £496 billion. This funding boost meets constitutional targets and will sustain state-funded treatment programs, budgeted at £10.1 billion, with no interruptions. The Egyptian cabinet also highlighted the country's health sovereignty drive. Egypt now produces 91% of its medicines locally, supported by 179 pharmaceutical factories, 11 of them internationally accredited, and nearly 1,000 drug production lines. These investments in universal health coverage and domestic manufacturing signal long-term policy commitments to accessible care. Oman's Healthy Schools Initiative, Oman's Ministries of Health and Education, together with a charitable foundation, signed a cooperation agreement to expand the National Health Promoting Schools program. The 5-year initiative will provide safer, healthier school environments aimed at boosting students' academic achievement, life skills, and well-being. Since launch, 566 schools across all governorates have participated, implementing activities in partnership with local health teams. Under the new pact, stakeholders will develop a unified strategy and dedicated funding to sustain the program, including an electronic monitoring platform. Omani officials stressed this education-health collaboration will reduce student illness, absences, and risk factors, while ingraining healthy habits from an early age. By institutionalizing school health standards and engaging communities, Oman is integrating wellness promotion into national policy. Legal mandates for child health. In Egypt, existing child welfare laws are being underscored to support public health goals. The Ministry of Health marked Egypt's achievement as the first African country to meet whose hepatitis B control target, crediting its 95% childhood vaccination rate under the National Immunization Program. Officials plan to localize vaccine production domestically to sustain this success. To further reinforce immunization, Egypt's child law explicitly obligates parents to vaccinate their children on schedule at public health clinics, provided free of charge. Parents who neglect routine vaccines can face fines up to £200 under Article 25 of the law. The law also enshrines children's rights to basic health and nutrition, instructing the state to ensure every child enjoys the highest attainable standard of health in a safe environment. By tightening enforcement of these provisions, Egypt is leveraging legal frameworks to maintain high vaccination coverage and protect child health. On to developments in life sciences and research innovation. AI-driven health research in Saudi Arabia. Saudi Arabia's drive to become a hub for biomedical innovation was evident in the work of young regional researchers this week. 2 graduates from the Mohammed bin Zayed University of Artificial Intelligence, MBZUAI, have developed next-generation AI tools aligned with Saudi's Vision 2030 healthcare plans. One project, HuLP, Human in the Loop for Prognosis, is an AI system for cancer survival prediction that uniquely allows clinicians to intervene and refine the model's predictions in real time. By incorporating doctors' feedback into the algorithm's learning process, HuLP produces more interpretable and patient-specific prognoses, addressing the black box problem of AI in medicine. A second innovation, Mediolo World, is an open vocabulary imaging AI capable of analyzing 9 different medical scan modalities, CT, MRI, ultrasound, microscopy, etc., at 70 frames per second. Unlike typical radiology AI limited to one task, Mediolo World can identify anomalies it wasn't explicitly trained on, enhancing scalability for smart hospitals. These AI tools, developed in the UAE but directly supporting Saudi Arabia's smart hospital transformation, underscore growing research collaboration in the region. They also show how local scientists are pushing the frontier of medical AI, with systems like HuLP and Mediolo World poised to improve cancer care and diagnostic accuracy in Saudi hospitals. Regional collaboration in cancer care. The UAE achieved a research milestone in oncology this week with Dubai Health Authority approving the country's first proton therapy center, an advanced radiation treatment facility for cancer. The project will be developed in partnership with the National Cancer Center Singapore, which will provide clinical and technical expertise. Scheduled to open in 2028, the Dubai Proton Center will eliminate the need for Middle Eastern patients to seek this cutting-edge therapy abroad. Proton beam therapy allows ultra-precise tumor targeting, especially for pediatric cancers and tumors near vital organs, with minimal damage to healthy tissue. Its introduction reflects the UAE's investment in scientific innovation to improve outcomes and position itself as a global medical hub. Similarly, Egypt's success in hepatitis B control was rooted in evidence-based public health practice, with 95% of children immunized and rigorous infection control. No healthcare workers in Egypt's hospitals have contracted HBV in recent years. Egypt's data-driven approach is now a model in Africa. Across the region, these examples illustrate how scientific research and innovation, whether through AI, new drugs, or advanced therapies, are translating into tangible healthcare advances. Next, we will discuss biotech and pharmaceutical developments. Local manufacturing and pharma self-reliance. Middle Eastern countries are rapidly expanding domestic pharmaceutical and biotech production. Egypt's Information and Decision Support Center reported that Egypt now meets 91% of its medication needs through local manufacturing, thanks to a robust base of 179 pharmaceutical factories, 11 internationally accredited, and 986 production lines. The government views this pharma self-sufficiency as a pillar of national health security and has increased the 2025 health budget accordingly. Iran likewise showcased its medical industries at the Iran Health 2025 exhibition in Tehran, June 8 to 11. The Vice President for Science and Technology announced that Iranian-made medical equipment is now exported to 60 countries worldwide, highlighting the competitiveness of Iran's health tech sector. Domestic manufacturers in Iran are partnering with the country's skilled medical experts to design high-quality devices that first meet local needs and then succeed in global markets. Tehran officials also launched special programs to better connect R&D with the medical equipment industry to drive further innovation and exports. These developments reflect a broader trend. Middle Eastern governments are prioritizing local production of medicines, vaccines, and health technologies, reducing import dependence and turning the region into an emerging exporter of health products. New vaccines and therapeutics. Advances continued in the development of vaccines and therapeutics. Iran held an unveiling for 23 new pharmaceuticals in late May, including novel drug formulations produced by domestic companies. While details of each product were not publicized, the range likely spans chronic disease treatments and biologic therapies aligned with Iran's focus on cancer and diabetes care. In Egypt, health officials announced plans to localize vaccine manufacturing as part of sustaining high immunization coverage. With Egypt already using 65 million vaccine doses annually and achieving exemplary hepatitis and polio control, local vaccine production capacity is seen as the next step in its biotech evolution. Meanwhile, Gulf states are investing in biopharmaceutical research through initiatives like Saudi Arabia's partnerships to produce insulin and gene therapies domestically, in line with Vision 2030 diversification goals. Radiopharmaceuticals and nuclear medicine also remain a niche of regional strength. Iran, for instance, has built a regional leadership in radioisotope production for cancer diagnostics and therapy. Across the Middle East, the biotech sector is thus marked by growing indigenous capabilities, new drug launches, rising export of medical supplies, and increasing capacity to produce critical vaccines and treatments locally. These strides not only promise economic benefits but also improve public health resilience by ensuring essential medicines are available even amid global supply chain disruptions. Controlling infectious diseases, robust vaccination programs and local biotech have yielded notable public health dividends. Egypt's Ministry of Health celebrated being the first country in Africa to control hepatitis B, achieving the WHO regional goal ahead of schedule. Officials attributed this success to Egypt's national childhood immunization program, with vaccination rates of 95% or higher, and concerted infection control measures in hospitals. Going forward, Egypt aims to manufacture the hepatitis B vaccine domestically to maintain immunity levels. In Iran, sustained polio immunization campaigns and surveillance, supported by WHO and UNICEF, have kept the country polio-free despite the threat of virus importation from nearby endemic areas. Iranian health experts have integrated polio program assets into the routine immunization system to guard against any resurgence. These examples underscore how investments in vaccines and disease-specific programs, backed increasingly by local biotech production, are enabling Middle Eastern nations to conquer or contain diseases that were major challenges in past decades. The continued strengthening of pharmaceutical manufacturing and immunization infrastructure stands to further reduce the burden of communicable diseases region-wide. Public health challenges and disease outbreaks developments is what we will explore now. Gaza's humanitarian health crisis. In Palestine's Gaza Strip, the already dire public health situation worsened amid ongoing conflict. Over the past 2 weeks, more than 200 Palestinians were killed and 2,000 plus injured, many of them hungry civilians shot near newly established aid distribution centers where Israeli forces opened fire. Gaza's hospitals, already under severe strain, have been overwhelmed by the influx of trauma cases. The UN Office for Humanitarian Affairs reported a complete collapse of internet and data services in Gaza after a fiber optic cable was damaged during military operations, paralyzing emergency coordination and even basic hospital communications. This digital blackout is hampering ambulances, disrupting supply management, and isolating civilians from critical information. Health officials warn that Gaza's healthcare system is on the brink. Fuel shortages, infrastructure damage, and insecurity are jeopardizing life-saving services. Aid agencies continue to call for safe humanitarian access, protection of civilians, and an end to violence, stressing that life-saving assistance should not be weaponized or obstructed. The crisis in Gaza highlights the acute public health toll of conflict, from mass casualty events and infrastructure collapse to the increased risk of infectious disease outbreaks in overcrowded shelters and rubble. Disease outbreaks in Iraq. Congo fever. Iraq is contending with a resurgence of Crimean Congo hemorrhagic fever, CCHF, a tick-borne viral disease. As of June 12, the Iraqi Health Ministry confirmed 123 CCHF cases nationwide in 2025, with 19 deaths so far. Over a quarter of all cases, 36, were recorded in Dakar province in the south, where livestock farming and abattoirs are common. CCHF spreads via ticks or contact with blood, tissues of infected animals during slaughter and has a high fatality rate, 10 to 40%. Iraq saw an unusual spike in infections in 2022, at least 27 deaths that year, after decades of only sporadic cases. The World Health Organization partly blamed that 2022 surge on lapses in tick control. Pesticide spraying campaigns were halted in 2020 to 2021, allowing vector populations to boom. This year, health officials are urging farmers, butchers, and veterinarians to rigorously use precautions, protective clothing, tick repellents, safe animal handling, to stem the fever's spread. The government is also reportedly restarting vector control programs. The re-emergence of CCHF in Iraq underscores how fragile gains in infectious disease control can be without sustained public health measures. It also highlights the occupational risk to agricultural communities and the importance of One Health approaches in managing diseases at the human-animal interface. Cholera and waterborne illnesses. In Syria and Yemen, waterborne diseases remain a looming threat amid collapsing infrastructure. The WHO's Eastern Mediterranean office launched an emergency cholera response for Syria after an outbreak late last year that saw over 1,400 suspected cholera cases and 7 deaths by December 2024. Poor water sanitation in conflict-affected areas fueled that outbreak, and while cases waned over the winter, the approaching summer raises concerns of a resurgence. Humanitarian groups warn that Syria's damaged water systems and displacement camps create ripe conditions for cholera and hepatitis A transmission. In Yemen, grappling with the world's largest humanitarian crisis, cholera has been endemic with periodic spikes since the civil war. UN officials this week emphasized that 30 million Yemenis, half the population, need life-saving aid, with many communities lacking clean water or sewage treatment. Indiscriminate attacks during years of war destroyed vital utilities, leading to repeated cholera waves infecting over 2 million Yemenis since 2017. Although a truce in the Red Sea coast area recently reduced fighting, aid agencies say funding shortages are limiting preemptive health measures. Malnutrition, especially among children, compounds the danger by weakening immunity to infectious diseases. The convergence of conflict, hunger, and disease in Syria, Yemen, and Gaza starkly illustrates how public health challenges in parts of the Middle East are largely man-made and how urgent ceasefires and reconstruction are for preventing major epidemics. Non-communicable disease burdens. In parallel, the region faces chronic health challenges such as non-communicable diseases, NCDs. Diabetes, cardiovascular illnesses, and cancers are on the rise due to aging populations and lifestyle changes. During the Gaza conflict, WHO noted that disruptions in healthcare access have left over 50,000 people with chronic diseases in Gaza without adequate medicines. Humanitarian efforts are trying to fill this gap. A new €10 million EU-funded initiative will prioritize delivering essential medications and support to primary clinics for patients with diabetes, hypertension, cancer, and other NCDs across Lebanon and Gaza. In Gulf states, the emphasis is on prevention. For example, the Kuwaiti anti-drug campaign, detailed below, also highlighted the mental health aspect of addiction and the need for integrated treatment of substance abuse as a chronic illness. As communicable disease control improves, Middle Eastern health ministries are increasingly turning attention to these NCD epidemics. However, conflicts and economic crises can quickly reverse progress, as seen when a lack of insulin or dialysis services threatens the lives of thousands of diabetic or renal failure patients in war-torn zones. Public health authorities are therefore juggling both immediate outbreak responses and long-term NCD management, a challenging duality that defined much of this week's developments. Another key area to discuss now is wellness and health promotion. Anti-drug campaigns. Kuwait has embarked on a national drug prevention campaign targeting youth, launched on June 12 to coincide with the International Day Against Drug Abuse and Illicit Trafficking. At the kickoff event in Kuwait City's Jabba Hospital, the Health Ministry's Dr. Abi Al-Bahu urged a science-based approach to tackle the country's growing addiction issues. The campaign, themed "The Evidence is Clear, Invest in Prevention to Break the Cycle," emphasizes community support, education, and global solidarity against narcotics trafficking. Officials stressed that effective drug policy must be rooted in evidence, human rights, and empathy, focusing on prevention and treatment rather than punishment. Alarm was raised over rising synthetic drug production and the link between addiction and mental health crises, prompting Kuwait to call for stronger integration of mental health services into addiction treatment. Public awareness efforts will highlight the dangers of new threats like so-called digital drugs, and the urgent need to boost forensic and law enforcement capabilities to intercept illicit substances. Running through the end of June, the campaign features school outreach, social media messaging, and community workshops to promote healthy, drug-free lifestyles among Kuwaiti youth. By openly addressing the drug problem, once a taboo topic, Kuwaiti authorities aim to safeguard their younger generation's wellness and prevent addiction before it starts. Healthy lifestyle initiatives. Oman and Bahrain, promoting healthier lifestyles is a priority across the region. In Oman, the newly expanded Health Promoting Schools initiative, discussed earlier, not only upgrades medical services in schools but also encourages nutrition, hygiene, and physical activity among students. By integrating health education into curricula and improving canteen standards, the program strives to instill lifelong healthy habits. Meanwhile, Bahrain celebrated Gulf Wellness Day with community events and media campaigns emphasizing exercise and nutrition in daily life, following Bahrain's earlier designation of 2025 as the Year of Public Health. This week in Manama, the Health Ministry also marked World Blood Donor Day, June 14, with blood drive promotions, thanking volunteer donors who form a backbone of the kingdom's healthcare system. Additionally, Bahrain's labor authorities conducted a Safe Summer awareness drive as noted, urging both employers and workers to pay attention to hydration, rest breaks, and first aid for heat exhaustion. The program involved site visits and distribution of educational materials about recognizing heat stress symptoms and proper outdoor work attire. By partnering with companies on these wellness measures, Bahrain hopes to reduce heat-related illnesses and reinforce a culture of safety and health in the workplace. Community health and prevention. Egypt and UAE. Egypt is leveraging technology and community networks to enhance preventive care. Health officials announced that parents of young children now receive SMS reminders 48 hours before each vaccination appointment, to ensure timely immunizations and prevent any lapses. This simple but effective nudge has helped Egypt boost vaccine compliance as part of its disease prevention strategy. Egypt's child law also underscores wellness in early childhood by mandating exclusive breastfeeding and proper nutrition. Article 7 recognizes breastfeeding's benefits and obliges the state to support mothers in this regard. In the UAE, the Ministry of Health launched a collaborative campaign linking its Hayat organ donation program with blood banks nationwide, aiming to foster a culture of community giving in health. While the campaign was unveiled earlier in the year, its activities continued into this month, including donor recognition events and public seminars on the life-saving impact of organ and blood donation. By integrating organ donation registration drives with blood donation outreach at malls and universities, UAE authorities are promoting altruistic health behaviors as a social norm. These various wellness and health promotion efforts, from combating substance abuse and poor diets to encouraging volunteerism in health, illustrate a preventive health paradigm taking root. Governments are not only treating illness but actively engaging their populations in staying healthy, often blending modern tools, text messages, apps, with traditional community engagement and legal frameworks to maximize impact. Next is the exciting area of digital health innovation. AI and telehealth in Saudi Arabia. Saudi Arabia continued to integrate artificial intelligence, AI, and digital platforms to modernize healthcare. During the 2025 Hajj pilgrimage season, June 4 to 9, Saudi health authorities deployed an AI-powered mass screening solution to protect millions of pilgrims from infectious disease. The Lunit Insight CXR system, a chest X-ray analysis AI, was used by the Saudi Ministry of Health and the Sayha Virtual Hospital to quickly detect signs of tuberculosis, pneumonia, and other respiratory illnesses among Hajj pilgrims. Early detection is critical during Hajj, when dense crowds and heat can exacerbate disease spread. By leveraging AI for rapid screening, Saudi Arabia identified potential infections in real time and isolated or treated affected pilgrims, helping avert outbreaks. This builds on Saudi's broader digital health investments. The Sayha Virtual Hospital, the region's largest telemedicine center, has been integrating AI tools across radiology and primary care services. Separately, Saudi hospitals are adopting AI in clinical workflows, from AI-assisted imaging at King Faisal Specialist Hospital to predictive analytics pilots under the Saudi Data and AI Authority. These efforts align with the kingdom's Vision 2030 goals of smart healthcare and have already yielded improved diagnostic throughput and consistency. Iran's Tech Pharma 2025 Summit. AI in Pharma. Iran this week demonstrated regional leadership in AI-driven drug discovery through the Tech Pharma 2025 Summit, the country's first international pharmaceutical technology conference. A highlight was the Tech Pharma AI School hosted at Zanjan University of Medical Sciences, which convened students and researchers for a 3-day immersion into how artificial intelligence can accelerate pharmaceutical R&D. Day 1 featured Iranian experts outlining AI's strategic role in pharma innovation and health policy, including global trends in AI-designed drugs. Subsequent days provided hands-on workshops in QSAR modeling for drug activity prediction, natural language processing for analyzing biomedical literature, and molecular dynamics simulations for drug formulation. The program culminated in teams pitching AI-based drug formulation projects, with the winning team receiving a research grant to develop their computational design for a diabetes medication. The summit underscored Iran's growing ecosystem at the intersection of tech and health. Organizers emphasized that bridging cutting-edge technologies with pharmaceutical science is crucial to shape the future of healthcare, and Iran is keen to position itself as an innovation hub despite external sanctions. By fostering collaboration between academia, startups, and industry at events like Tech Pharma, Iran is accelerating the adoption of AI, machine learning, and big data in drug development, a field that could revolutionize how quickly new therapies are discovered and brought to market. Telemedicine and virtual care. Across the Middle East, digital health platforms are expanding access to care, especially in remote or crisis settings. In Qatar, the Primary Health Care Corporation reported that during the Eid al-Adha holiday, June 5 to 9, its community call center provided 455 virtual medical consultations via hotline 16,000, using video and phone to manage urgent cases and refill prescriptions when clinics were closed. This ensured continuity of care for patients over the holiday, complementing in-person urgent care services at select health centers. Qatar's embrace of telehealth is part of a digital health strategy that also includes an integrated electronic health record system, Cerner, linking hospitals, and a national patient portal for online appointments and medication deliveries. Even in war-torn Syria, WhatsApp and Telegram have been used by diaspora physicians to advise colleagues on complex cases. Meanwhile, the UAE continues to promote smart health apps. Dubai's Doctor for Every Citizen telemedicine initiative offers 24/7 virtual GP consultations, which proved invaluable during public holidays and the pandemic. Governments are investing in broadband and mobile health platforms as core health infrastructure. While issues like digital literacy and internet outages, as seen in Gaza, present hurdles, Overall, the Middle East is rapidly catching up in telehealth adoption, a trend only accelerated by COVID-19 and now becoming a permanent fixture of healthcare delivery. Developments surrounding hospitals is next. Advanced Treatment Facilities (UAE). The United Arab Emirates took a significant step in healthcare infrastructure with plans for a state-of-the-art proton therapy center in Dubai, the nation's first such cancer treatment facility. The Dubai Health Authority (DHA) granted initial approval for the project on June 12, marking a historic milestone in regional cancer care. Expected to open by late 2028, the center will offer highly precise proton beam radiation therapy, which can target tumors, especially in children or near vital organs, with minimal collateral damage to healthy tissue. Currently, patients across the Middle East must travel abroad for proton therapy. The new Dubai center will for the first time provide this cutting-edge modality locally, improving patient access and reducing treatment costs. The facility is being developed in partnership with the National Cancer Center Singapore to ensure world-class expertise. DHA's Director General Dr. Alawi Al-Sheikh Ali noted that introducing proton therapy aligns with national strategic goals, including the UAE's Vision 2031 for well-being, and bolsters Dubai's aim to rank among the global top 10 cities for healthy life expectancy. It also supports Dubai's medical tourism targets of attracting 500,000 international patients annually by 2025. The Proton Center's approval reflects how UAE authorities are marrying infrastructure investment with public health objectives, solidifying the country's reputation as a regional hub for advanced medical treatment. Hospital expansion in Jordan. Jordan has been upgrading its hospital network as part of its push toward universal health coverage. Under the Comprehensive Health Coverage Plan, the Ministry of Health recently completed expansion works at Prince Hussein bin Abdullah II Hospital and 2 other hospitals, increasing bed capacity and adding new surgical and intensive care units. Foundation stones were also laid for a major extension of Ma'an Government Hospital in the south. These projects, funded partly through grants from Gulf partners like the Kuwait Fund for Arab Economic Development, aim to improve tertiary care in underserved regions. Jordan's strategy also involves strengthening primary healthcare centers to reduce strain on hospitals. 34 small clinics were consolidated into larger, comprehensive health centers, with broader services, and 12 brand new health centers opened across various governorates in the past year. By prioritizing primary care and preventative services, Jordan hopes to decrease unnecessary hospital admissions and provide more equitable health access. However, when advanced care is needed, the recent hospital improvements ensure that more Jordanians can be treated within the country instead of having to seek care abroad. The health minister publicly thanked Kuwait and other donors for supporting Jordan's health infrastructure, underscoring the importance of regional cooperation in bolstering hospital capacity. Healthcare resilience in conflict zones. In conflict-affected states, preserving hospital functionality is an ongoing battle. In Lebanon, which faced border clashes in late 2024, field hospitals and clinics were set up to support displaced civilians. This week, Lebanon's Hajj Medical Mission reported that it had run fully equipped clinics at the Mina and Arafat sites in Saudi Arabia during Hajj, treating dozens of Bahraini and Lebanese pilgrims for heat fatigue and dehydration on the spot. This prevented more serious cases from needing hospital evacuation. Back home in Lebanon, international aid is focused on rebuilding critical hospital infrastructure. A new European-funded initiative will help re-establish Lebanon's central public health laboratory, destroyed in the Beirut blast, and supply medications to struggling public hospitals treating chronic patients. In Yemen, despite the relative calm on the Red Sea front, many hospitals remain inoperative due to damage or lack of supplies. Humanitarian agencies are providing generator fuel and cholera kits to keep key facilities open. And in Syria, the WHO has been supporting mobile health units and trauma centers in the northeast where health facilities were destroyed by conflict. While prosperous Gulf states announce futuristic hospitals and clinics, these war-torn countries are focused on simply keeping the doors of existing hospitals open. Nonetheless, even modest improvements like repairs to a maternity ward or delivery of insulin stocks can have outsized impacts on local populations. The stark disparity in hospital conditions across the Middle East is a reminder of how peace and stability are prerequisites for sustained health development. And now we will discuss population health management. Mass screening and maternal health. Egypt's ongoing public health campaigns continue to yield results in managing population health. The Ministry of Health announced that as part of President El-Sisi's 100 Million Healthy Lives initiative, over 3.25 million women have been screened to date under the Maternal and Fetal Healthcare Program. This nationwide initiative, launched in 2020, provides free prenatal screening to detect early diseases that could be transmitted from mother to baby, such as HIV, hepatitis B, and syphilis, and ensures timely treatment. Each expectant mother is tracked through 42 days postpartum, allowing health teams to catch any complications in either the mother or newborn and provide follow-up care. The program also guarantees confidentiality and counseling on prevention for all participants. By institutionalizing these screenings at hundreds of primary health units, Egypt has improved early detection of high-risk pregnancies and significantly reduced mother-to-child transmission of infections. It reflects an effective population health strategy, proactively identifying health risks among a large target demographic, in this case, pregnant women and infants, and intervening early to improve outcomes. Alongside other Egypt initiatives like the neonatal screening for genetic disorders and the periodic school health examinations, this contributes to healthier new generations and reduces the long-term burden on the healthcare system. Telehealth and holiday coverage. Qatar showcased a robust approach to managing population health demand surges during the Eid holiday week. The Primary Health Care Corporation, PHCC, kept 21 health centers open on call across the country from June 5 to 9, which together handled 16,867 patient visits ranging from family medicine consults, 7,528 cases, and general dentistry, 896 cases, to 6,560 urgent care visits for acute conditions. Specialized clinics were also staffed and received hundreds of patients during Eid. Importantly, the call center provided nearly 500 telemedicine consultations, video, audio, via its hotline, enabling patients to get medical advice or prescription refills remotely when possible. This integrated approach, combining in-person urgent care with virtual care, ensured that both citizens and residents had continuous access to medical guidance despite the holiday closures of many routine services. It prevented overcrowding at emergency rooms and allowed triaging of cases so that only true emergencies went to hospitals. Qatar's experience highlights the value of flexible primary care models in population health management. By anticipating increased healthcare needs during holidays and leveraging telehealth, the system maintained continuity of care and avoided lapses in treatment for chronic patients. International support for chronic care. Lebanon. In Lebanon, international organizations are stepping in to shore up population health amid economic collapse. The European Investment Bank and WHO formally launched a €10 million grant initiative to strengthen Lebanon's public health system, with a focus on chronic disease management for vulnerable populations. A key component is restoring the Central Public Health Laboratory in Beirut, which will vastly improve disease surveillance and diagnostic capacity, especially for emerging infections, once rebuilt. Another priority is supplying essential medicines and technical support to primary healthcare centers across Lebanon, which serve as the first line of care for those with diabetes, hypertension, cancer, and other chronic conditions. Over 50,000 patients with NCDs, including many Syrian refugees and low-income Lebanese, are expected to benefit through access to medications like insulin, antihypertensives, and chemo drugs that have been scarce due to currency devaluation. By buttressing primary care, the initiative helps keep chronic patients stable and out of hospitals, a critical need given Lebanon's hospital sector is under severe financial strain. Public statements from WHO Dr. Tedros and EU ambassadors stressed that this support will make a real difference in expanding access to life-saving medicines and bolstering Lebanon's ability to respond to health emergencies. This kind of targeted population health intervention, focusing on continuity of chronic care and strengthening health system resilience, is crucial to prevent a wholesale collapse of health outcomes in Lebanon's crisis. It exemplifies how international aid can be aligned with population health management goals to sustain long-term care in challenging contexts. Immunization and health education. Region-wide, immunization remains a cornerstone of population health efforts. Syria, despite conflict, has managed to stay polio-free since containing outbreaks in 2013 and 2017, thanks to repeated nationwide vaccination campaigns and surveillance that are now being integrated into routine services with support from Gavi and WHO. Jordan and Iraq both continue aggressive polio and measles immunization drives as part of their public health strategy, with Iraq recently vaccinating nearly 232,000 children in high-risk areas, including conflict-affected zones in northeast Syria under its aid programs. In the UAE, public health messaging is leveraging technology. Parents are reminded of their children's vaccination appointments via SMS, an initiative that has helped raise on-time vaccination rates and is now being expanded to reminders for adult preventive screenings as well. Health education is also being woven into the fabric of primary care. For example, Saudi Arabia's Kello Health app and Oman's new electronic school health platform provide tailored wellness tips and allow individuals to track their health metrics, encouraging more proactive health management by the population. These activities across immunization, health education, and chronic care underscore a shift in many Middle Eastern health systems toward preventive, population-wide approaches. By focusing not just on treating illness but on keeping communities healthy through organized programs, countries are gradually bending the curve of disease, though the successes are uneven and often interrupted by conflict or resource limitations in parts of the region. So let's now summarize and conclude this week's summary. This week's developments highlight a Middle East in transition towards stronger health systems and innovation. On one hand, Gulf states like the UAE, Saudi Arabia, and Qatar are rapidly modernizing healthcare, building world-class hospitals, embracing AI and digital health, and pioneering public health campaigns backed by robust government investment. Their initiatives to protect workers from heat, to leverage talent for AI-driven care, and to localize drug production all point to a forward-looking health agenda focused on sustainability and self-reliance. Similarly, countries such as Egypt, Iran, and Jordan are making significant strides. Egypt's aggressive disease control and screening programs are paying off in improved indicators, and Jordan is steadily expanding coverage and infrastructure. These successes, however, stand in stark contrast to the dire health challenges in conflict zones like Gaza, Yemen, and parts of Syria and Lebanon. In those places, hospitals and clinics struggle to function amid violence or economic freefall, and basic health gains hang by a thread. The regional health narrative is thus one of dual realities: remarkable progress in stability and unprecedented hardship in instability. Encouragingly, there is growing recognition of shared responsibility and cooperation. Gulf donors are funding clinics in Jordan and Lebanon, international agencies are rallying to support populations in Syria, Yemen, and Gaza, and knowledge exchange is evident as Arab experts and institutions collaborate, for instance, UAE and Saudi partnerships in AI research, or cross-border Hajj health efforts. If peace efforts in Yemen progress and ceasefires hold in Gaza and Sudan, we may see a much-needed shift from emergency response to recovery and health system rebuilding in those areas. Across the Middle East, major trends include a pivot to preventive care, wellness initiatives, mandatory immunizations, integration of cutting-edge tech, AI, telehealth, to overcome resource gaps, and an emphasis on resilience, whether through localizing supplies or training healthcare workers to withstand shocks. The coming weeks will test how these initiatives continue to unfold. But for now, the region's health trajectory is cautiously optimistic. Even as challenges persist, Middle Eastern countries are laying critical groundwork for healthier, longer lives for their people, driven by lessons learned and a vision of a more equitable, innovative healthcare future for all. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening, and until next time, have a wonderful week.